Alaikum. Welcome to my YouTube channel ENT Made Easy. Today I have got an interesting case basically to discuss with you people and to educate our juniors. And I have got one patient with the hearing loss for the last 1.5 years. It was basically gradual in onset and it was bilateral, and now even he cannot appreciate sound, he cannot understand the words, he cannot localize the sound, and he has difficulty in his speaking, but there is no intolerance to the sound and there is no disequilibrium induced due to the loud sound. But he has got very positive findings in his history, and the purpose for the video is to basically tell our juniors that how the history is impactful or the significance. Once you take history, then you get to know many things about the disease course, and you get to know about the diagnosis. That is the reason usually our seniors always recommend us, and they push us that we are supposed to take good history and do good history examination in our practice or in an exam. So he had got positive history of the childhood air discharge for almost 10 to 15 years. After that, he also had decreased hearing, but that was not much on that time, so that they did not take care about it, and it did not bother him really. Then he had got positive history of the pulmonary tuberculosis, and he was on ATT for the last 9 months, and that included basically peroral and the IV medications. And after that, he had the prolonged history of acute febrile illness for like 4 to 6 weeks, and according to his father, that was probably dengue on that time, and dengue with complications. So once he had dengue, he had got severe hearing loss, and that was troublesome for him, so that then he visited to the ENT consultant, and he was undergone the examination, and his audiological assessment were done from some of ENT surgeon, and his PTA had shown a bilateral severe deafness, severe to profound in left rather, and he was further basically sent for audiological investigations, and to another station like for ABR, and his ABR also showed that he had got profound to the severe deafness, and he was advised to use hearing aid, and although he was given option for the cochlear implant, but due to the non affordability, of course patient did not go for the cochlear implant, and he did not opt for it. Rather, he used hearing aid for like almost 1.5 months or 3 months probably. But now he is not even responding to the hearing aids. So basically, the purpose of telling the detailed history is this is nothing but the acquired bilateral sensorineural deafness, and there are well multiple causes behind it, like CSM was the instigator factor, followed by the tuberculosis and the drug induced, that was the ATT, and the acute febrile illness. And again, you can say maybe a hearing aid like noise induced, because he had complaint of basically noisy sounds while he was using hearing aid. Now, once I will show you the basically auto endoscopy now. He has got basically the findings in his ear as well, so that I thought I should discuss with you regarding the history and the examination. So you can see this is the autoendoscopy of his right ear, and there is a excoriation at the posterior canal along with the blood clot, because he has got itching these days, and that is the trauma induced. Then vex at the superior canal, and you can see that he has got the subtotal perforation, and with heel margins, and rest of the tympanic membrane is normal, and the middle ear mucosa is reddish, congested, and edematous. Now I will show you the left ear. Now you can see this is the left ear autoendoscopy, and you can see that he has again got a large central perforation with the wet, a yellowish mucopurulent air discharge in the external auditory canal, along with the dry hard wax, and he has got the large central perforation, and along with the middle ear mucosa congested and inflamed. So at this moment he has got active bilateral CSY, active mucosal probably. So The plan will remain same. First, we are going to treat his CSOM. Then, once the air will be discharged, we will try to offer him basically the high power hearing aid. But as counseling has been done to the patient, that he is not going to respond to that. Probably, other thing is that he is the ideal basically candidate for the bilateral cochlear implant. Thank you so much.